NAPLEX Full Mock Exam 225. Exam-style practice questions. These questions are pharmacist-written, blueprint-aligned, and focused on clinical decision-making, medication safety, calculations, and patient care, exactly what you will face on test day. Treat this like the real exam. Work through each question carefully before looking at the answer and explanation. A patient with atrial fibrillation is prescribed apixaban. Which counseling point is most important? Option A, take with food to improve absorption. Option B, avoid green leafy vegetables. Option C, do not stop the medication abruptly without provider guidance. Option D, take the medication only at bedtime. Correct answer, C. Abrupt discontinuation of apixaban increases the risk of thrombotic events. Patients should not stop therapy without provider guidance. Food does not significantly affect absorption, and vitamin K intake is not relevant to apixaban. A patient with chronic kidney disease has an estimated CRCL of 22 milliliters per minute and is taking metformin for type 2 diabetes. What is the best recommendation? Option A, continue standard dose. Option B, reduce dose by half. Option C, discontinue metformin. Option D, switch to extended release formulation. Correct answer, C. Metformin is contraindicated when eGFR CRCL is less than 30 milliliters per minute due to increased risk of lactic acidosis. Switching to ER does not mitigate this risk. How many milliliters of a 20% WV dextrose solution are needed to provide 50 grams of dextrose? Option A, 200 milliliters. Option B, 225 milliliters. Option C, 250 milliliters. Option D, 275 milliliters. Correct answer, C. 20% WV equals 20 grams per 100 milliliters. Volume needed equals 50 grams divided by 20 grams 100 milliliters equals 50 times 100 divided by 20, 250 milliliters. A patient taking warfarin is started on trimethoprim sulfamethoxazole for cellulitis. What is the most appropriate action? Option A, no change, counsel to take with food. Option B, hold warfarin for 7 days. Option C, increase warfarin dose by 10%. Option D, anticipate increased INR and monitor closely with dose adjustment. Correct answer, D. TMP-SMX can increase INR by inhibiting warfarin metabolism and altering gut flora. The safest approach is closer INR monitoring and warfarin dose adjustment as needed, not an automatic hold. A 68-year-old with heart failure with reduced ejection fraction is started on sacubitril/valsartan. The patient has been taking lisinopril. What is required before starting sacubitril/valsartan? Option A, start sacubitril/valsartan the next morning after last lisinopril dose. Option B, a 36-hour washout after stopping lisinopril. Option C, a 7-day washout after stopping lisinopril. Option D, continue lisinopril at a lower dose with sacubitril/valsartan. Correct answer, B. Concomitant ACE inhibitor and neprilysin inhibitor increases angioedema risk. A 36-hour washout is required after stopping an ACE inhibitor, before initiating sacubitril/valsartan. A patient is prescribed vancomycin IV. Which monitoring strategy best helps prevent nephrotoxicity while ensuring efficacy? Option A, trough-only monitoring targeting 15 to 20 milligrams liter for all patients. Option B, AUC-guided monitoring targeting AUC-MIC 400 to 600, assuming MIC 1. Option C, random levels without timing considerations. Option D, monitoring only serum creatinine weekly. Correct answer, B. AUC-guided monitoring, AUC-MIC 400 to 600, is preferred to balance efficacy and reduce nephrotoxicity risk. Trough-only targets can overexpose some patients. A pediatric patient weighs 22 pounds and is prescribed amoxicillin 45 mg per kilogram day, divided twice daily. How many milligrams per dose should be administered? Option A, 100 milligrams. Option B, 150 milligrams. Option C, 225 milligrams. Option D, 300 milligrams. Correct answer, C. 22 pounds divided by 2.2 equals 10 kilograms. Daily dose equals 45 milligrams per kilogram day times 10 kilograms equals 450 milligrams per day. Divided BID equals 225 milligrams per dose. A patient on chronic prednisone 20 milligrams daily for several months is scheduled for elective surgery. Which counseling point is most appropriate? Option A, stop prednisone 24 hours before surgery. Option B, continue prednisone, may require stress dose steroids per provider. Option C, double prednisone dose for 1 week before surgery without provider input. Option D, switch to dexamethasone the day of surgery. Correct answer, B. Chronic systemic steroids can suppress the HPA axis. Patients should not abruptly stop steroids. Perioperative stress dosing may be needed depending on procedure and suppression risk. A patient is prescribed nitrofurantoin for uncomplicated cystitis. Which patient factor would make nitrofurantoin an inappropriate choice? Option A, history of penicillin allergy. Option B, CRCL 25 milliliters per minute. Option C, female sex. Option D, dysuria for 2 days. Correct answer, B. Nitrofurantoin is generally not recommended in significant renal impairment, commonly CRCL less than 30 milliliters per minute, due to reduced urinary concentrations and increased toxicity risk. A patient receives a prescription for insulin glargine U100. Inject 18 units nightly. The pharmacy has insulin glargine U300 available. What is the best dispensing action? Option A, dispense U300 and instruct to inject 6 units nightly. Option B, dispense U300 and instruct to inject 18 units nightly. Option C, contact prescriber. U100 and U300 are not automatically interchangeable. Option D, dispense U300 and instruct to inject 54 units nightly. Correct answer, C. U100 and U300 glargine have different pharmacokinetics and are not automatically interchangeable. Conversion may be needed and should be prescriber-directed. High alert medication safety applies. A patient with hypertension is taking lisinopril and develops swelling of lips and tongue. What is the most appropriate recommendation? Option A, continue lisinopril and add an antihistamine. Option B, stop lisinopril and seek emergency care immediately. Option C, reduce lisinopril dose by 50%. Option D, switch to another ACE inhibitor. Correct answer, B. This suggests angioedema, a potentially life-threatening ACE inhibitor adverse effect. Discontinue immediately and seek emergency care. Switching within ACE inhibitors is contraindicated. A prescriber orders levothyroxine 75 microgram PO daily. The patient asks how to take it. Which counseling point is best? Option A, take with calcium to improve absorption. Option B, take at bedtime with a high-fat snack. Option C, take on an empty stomach consistently, separated from iron calcium by several hours. Option D, take only on weekdays to prevent tolerance. Correct answer, C. Levothyroxine absorption is reduced by food and by cations, calcium, iron. Consistent administration on an empty stomach with separation from interacting agents improves stability of thyroid levels. A patient receives an IV admixture containing ceftriaxone and calcium-containing solutions are scheduled. What is the primary concern? Option A, reduced ceftriaxone potency due to light exposure. Option B, risk of precipitate formation when mixed with calcium-containing solutions. Option C, increased risk of ototoxicity. Option D, increased risk of serotonin syndrome. Correct answer, B. Ceftriaxone can precipitate with calcium-containing solutions, notably in neonates, but incompatibility concerns apply. Avoid co-administration mixing in the same line without appropriate precautions. A patient with cirrhosis Child-Pugh C is prescribed rivaroxaban for DVT treatment. What is the best recommendation? Option A, continue rivaroxaban at standard dose. Option B, increase rivaroxaban dose due to reduced absorption. Option C, avoid rivaroxaban. Severe hepatic impairment increases bleeding risk. Correct answer, C. Rivaroxaban is generally avoided in significant hepatic impairment, especially Child-Pugh BC, due to altered metabolism and increased bleeding risk. Aspirin is not an appropriate DVT treatment. How many grams of potassium chloride are needed to prepare 500 milliliters of 0.9% WV-KCl solution? Option A, 2.5 grams. Option B, 4.5 grams. Option C, 5.0 grams. Option D, 9.0 grams. Correct answer, B. 0.9% WV equals 0.9 grams per 100 milliliters. For 500 milliliters, 0.9 grams per 100 milliliters times 500 milliliters. A patient takes sertraline and is prescribed linezolid for pneumonia. What is the primary risk? Option A, QT prolongation. Option B, serotonin syndrome. Option C, Stevens-Johnson syndrome. Option D, severe hypoglycemia. Correct answer, B. Linezolid is a reversible MAOI and can precipitate serotonin syndrome when combined with SSRIs like sertraline. Alternative therapy or careful management is needed. A patient with type 1 diabetes uses an insulin pump and develops vomiting and abdominal pain. Home glucose is 240 milligrams per deciliter. What is the best recommendation? Option A, skip insulin until eating normally. Option B, check ketones and seek urgent evaluation if positive or symptoms worsen. Option C, take an extra dose of metformin. Option D, drink juice to prevent hypoglycemia. Correct answer, B. Symptoms suggest possible diabetic ketoacidosis, especially with pump failure. Patients should check ketones and seek urgent care if ketones are present or symptoms worsen. Insulin should not be skipped. A prescription reads, Morphine sulfate ER 30 mg PO Q12H. The pharmacy has morphine IR 30 mg tablets. What should the pharmacist do? Option A, substitute IR for ER and dispense as written. Option B, dispense IR and instruct patient to take once daily. Option C, contact prescriber. ER and IR are not interchangeable. Option D, dispense IR and double the dose. Correct answer, C. Extended release and immediate release opioids have different dosing and safety profiles. Automatic substitution is unsafe. Opioids are high-alert medications requiring prescriber clarification. A patient is being treated for H. pylori with clarithromycin-based therapy and is taking simvastatin. What is the best action? Option A, continue simvastatin, no interaction. Option B, hold simvastatin during clarithromycin therapy. Option C, double simvastatin dose to maintain LDL control. Option D, switch clarithromycin to azithromycin without prescriber input. Correct answer, B. Clarithromycin is a strong CYP3A4 inhibitor and can significantly increase simvastatin levels, increasing myopathy, rhabdomyolysis risk. Holding simvastatin temporarily is common. Coordinate as appropriate. A patient needs a continuous infusion of heparin at 1,200 units per hour. The bag contains heparin, 25,000 units in 500 milliliters. What infusion rate, milliliters per hour, is needed? Option A, 12 milliliters per hour. Option B, 18 milliliters per hour. Option C, 24 milliliters per hour. Option D, 30 milliliters per hour. Correct answer, C. Concentration equals 25,000 units divided by 500 ml equals 50 units per ml. Rate equals 1,200 units per hour divided by 50 units per ml equals 24 milliliters per hour. A pregnant patient, first trimester, asks for an OTC option for nausea. Which is an appropriate first-line recommendation? Option A, isotretinoin. Option B, doxylamine plus pyridoxine. Option C, warfarin. Option D, misoprostol. Correct answer, B. Doxylamine pyridoxine is a first-line option for nausea, vomiting of pregnancy. The other options are contraindicated or inappropriate. A patient with asthma is prescribed propranolol for migraine prophylaxis. What is the primary concern? Option A, propranolol causes hypokalemia. Option B, propranolol may worsen bronchospasm. Option C, propranolol increases serotonin syndrome risk. Option D, propranolol reduces warfarin effect. Correct answer, B. Non-selective beta blockers like propranolol can block beta-2 receptors and provoke bronchospasm in asthma. Consider alternatives or cardioselective agents if appropriate. A compounded oral suspension requires 240 milliliters final volume at 25 milligrams per milliliter. How many grams of active drug are needed? Option A, 3 grams. Option B, 4 grams. Option C, 6 grams. Correct answer, C. Total drug needed equals 25 milligrams per milliliter times 240 milliliters equals 6,000 milligrams equals 6 grams. A patient is on lithium for bipolar disorder and starts ibuprofen regularly for back pain. What is the most appropriate counseling? Option A, Ibuprofen decreases lithium levels. Monitor for relapse. Option B. Ibuprofen can increase lithium levels. Monitor for toxicity and consider alternatives. Option C. No interaction. Take together with food. Option D. Lithium should be stopped immediately. Correct answer B. NSAIDs can reduce renal clearance of lithium, increasing levels and toxicity risk, tremor, GI upset, confusion. Counsel to avoid chronic NSAIDs use and monitor levels if needed. A patient is discharged on enoxaparin 1 mg per kilogram subcutaneously every 12 hours. The patient weighs 176 pounds. What is the dose per injection? Option A, 40 milligrams. Option B, 60 milligrams. Option C, 80 milligrams. Option D, 100 milligrams. Correct answer, C. 176 pounds divided by 2.2 equals 80 kilograms. Dose equals 1 milligram per kilogram equals 80 milligrams every 12 hours. A patient with anaphylaxis to latex requires an injectable medication. What is an important dispensing consideration? Option A. Use any vial. Latex allergy is irrelevant. Option B. Avoid products with natural rubber latex and vial stoppers/syringe components when possible. Option C. Only dispense tablets. Option D. Refrigerate all injectables to prevent latex reaction. Correct answer, B. Some vial stopper syringe components may contain natural rubber latex, which can trigger reactions in sensitized patients. Select latex-free options when possible. A patient is prescribed phenytoin and begins enteral tube feedings continuously. What is the best management strategy? Option A. Increase phenytoin dose automatically. Option B. Stop tube feeds permanently. Option C. Separate phenytoin administration from tube feeds. Hold feeds before, after, and monitor levels. Option D. Switch phenytoin to topical formulation. Correct answer, C. Enteral feeds can reduce phenytoin absorption. Holding feeds around dosing and monitoring levels helps maintain therapeutic concentrations. An IV medication is labeled Protect from Light and is prepared in a clear syringe. What is the best immediate action? Option A. Dispense as is. Light protection is optional. Option B. Cover the syringe with an opaque, light protective wrap. Option C. Add a buffering agent. Option D. Freeze the syringe before dispensing. Correct answer, B. Some medications are photo-label and require protection to maintain stability. Using an amber syringe or light protective covering is appropriate. A patient is started on spironolactone for heart failure and is also taking potassium chloride supplements. What is the best recommendation? Option A. Continue both, no monitoring needed. Option B. Stop spironolactone immediately. Option C. Assess need for potassium supplement and monitor potassium closely due to hyperkalemia risk. Option D. Add an ACE inhibitor to offset potassium increase. Correct answer, C. Spironolactone can raise potassium. Concurrent potassium supplements increase hyperkalemia risk, especially in renal impairment. Evaluate necessity and monitor serum potassium/renal function. A patient is prescribed cefazolin 2 grams IV pre-op. The vial is labeled 1 gram, 10 ml after reconstitution. How many milliliters are needed for the dose? Option A, 10 ml. Option B, 15 ml. Option C, 20 ml. Option D, 25 ml. Correct answer, C. Concentration after reconstitution is 1 gram per 10 milliliters. For 2 grams, volume equals 2 times 10 milliliters, 20 milliliters. A patient with a history of peptic ulcer disease is prescribed naproxen for arthritis pain. Which recommendation is most appropriate to reduce GI risk? Option A, take naproxen on an empty stomach. Option B, add omeprazole for GI protection. Option C, switch naproxen to acetaminophen without consulting provider. Option D, double the naproxen dose for better pain relief. Correct answer, B. NSAIDs increase risk of GI bleeding, especially in patients with ulcer history. A proton pump inhibitor like omeprazole reduces this risk. A patient with epilepsy is stabilized on lamotrigine and begins taking an estrogen-containing oral contraceptive. What is the expected effect? Option A, increased lamotrigine levels. Option B, decreased lamotrigine levels requiring monitoring. Option C, no interaction. Option D, increased risk of serotonin syndrome. Correct answer, B. Estrogen induces lamotrigine metabolism, decreasing lamotrigine levels and potentially increasing seizure risk. Monitoring and dose adjustment may be needed. How many milligrams of drug are needed to prepare 300 milliliters of a 2% WV solution? Option A, 3,000 milligrams. Option B, 6,000 milligrams. Option C, 9,000 milligrams. Option D, 12,000 milligrams. Correct answer, B. 2% WV equals 2 grams per 100 milliliters. For 300 milliliters, 2 grams times 3 equals 6 grams equals 6,000 milligrams. A patient taking clopidogrel is started on omeprazole. What is the concern? Option A, increased bleeding risk. Option B, reduced clopidogrel effectiveness. Option C, increased clopidogrel toxicity. Option D, no interaction. Correct answer, B. Omeprazole inhibits CYP2C19, reducing conversion of clopidogrel to its active form, decreasing antiplatelet effect. A patient with CRCl 28 milliliters per minute is prescribed levofloxacin 750 milligrams daily. What is the best recommendation? Option A, continue standard dose. Option B, increase dose. Option C, recommend renal dose adjustment. Option D, switch to topical formulation. Correct answer, C. Levofloxacin is renally cleared and requires dose adjustment in renal impairment to prevent accumulation and toxicity. A patient is receiving total parenteral nutrition, TPN. Which component must be protected from light during administration? Option A, sodium chloride. Option B, amino acids. Option C, lipid emulsion. Correct answer, D. Multivitamins and TPN are light-sensitive and require protection to prevent degradation. A child weighing 15 kilograms is prescribed acetaminophen 15 milligrams kilograms dose every 6 hours. What is the dose per administration? Option A, 150 milligrams. Option B, 200 milligrams. Option C, 225 milligrams. Option D, 300 milligrams. Correct answer, C. 15 milligrams kilogram times 15 kilograms equals 225 milligrams per dose. A patient on methotrexate for rheumatoid arthritis asks about folic acid supplementation. What is the best response? Option A, avoid folic acid. It reduces efficacy. Option B, take folic acid daily to reduce toxicity. Option C, only take folic acid if nausea occurs. Option D, take folic acid once yearly. Correct answer, B. Folic acid reduces methotrexate-related adverse effects, e.g. mucositis, anemia, without significantly reducing efficacy. A patient with heart failure is taking furosemide and reports muscle cramps. What lab value is most important to check? Option A, sodium. Option B, potassium. Option C, glucose. Option D, calcium. Correct answer, B. Loop diuretics can cause hypokalemia, which may present as muscle cramps and increases arrhythmia risk. A prescription reads digoxin 0.25 milligrams PO daily. The patient is elderly with low body weight and renal impairment. What is the best action? Option A, dispense as written. Option B, recommend lower dose due to toxicity risk. Option C, double the dose. Option D, switch to IV form. Correct answer, B. Digoxin has a narrow therapeutic index and is renally cleared. Elderly, low weight, and renally impaired patients are at higher risk for toxicity. How many ml/hour should a patient receive if 1,000 ml IV fluid is to be infused over 8 hours? Option A, 100 ml/hour. Option B, 110 ml/hour. Option C, 120 ml/hour. Option D, 125 ml/hour. Correct answer, D. 1,000 milliliters divided by 8 hours equals 125 milliliters per hour. A patient is prescribed isotretinoin. What is a critical counseling point? Option A, take with antacids. Option B, avoid all sunlight. Option C, strict pregnancy prevention due to teratogenicity. Option D, avoid dairy products. Correct answer, C. Isotretinoin is highly teratogenic. Strict adherence to pregnancy prevention programs is essential. A patient is prescribed piperacillin, tazobactam, and vancomycin. What monitoring is important? Option A, liver enzymes only. Option B, serum creatinine due to nephrotoxicity risk. Option C, blood glucose. Option D, INR. Correct answer B. Combination increases risk of acute kidney injury. Renal function monitoring is critical. A patient with gout is taking allopurinol and develops a rash. What is the best action? Option A, continue therapy. Option B, stop allopurinol and seek evaluation. Option C, reduce dose. Option D, add antihistamine. Correct answer, B. Rash may signal serious hypersensitivity, e.g., SJS. Immediate discontinuation is warranted. A compounded cream requires 5% WW drug in 200 grams base. How many grams of drug are needed? Option A, 5 grams. Option B, 8 grams. Option C, 10 grams. Option D, 12 grams. Correct answer, C. 5% of 200 g equals 10 grams. A patient is prescribed bupropion and has a history of seizures. What is the concern? Option A, hypertension. Option B, increased seizure risk. Option C, kidney failure. Correct answer, B. Bupropion lowers seizure threshold and is contraindicated in patients with seizure disorders. A patient with COPD uses tiotropium. What is an important counseling point? Option A, use as rescue inhaler. Option B, swallow capsules whole. Option C, inhale contents of capsule using device. Do not swallow. Option D, take only during flare-ups. Correct answer, C. Tiotropium capsules are for inhalation only using the device. Swallowing is ineffective. A patient taking valproic acid begins meropenem therapy. What happens? Option A, valproic acid levels increase. Option B, valproic acid levels decrease significantly. Option C, no interaction. Option D, increased bleeding risk. Correct answer, B. Carbapenems significantly reduce valproic acid levels, risking seizure breakthrough. A patient needs 2,000 milliliters IV over 24 hours. What is the ml/hour rate? Option A, 60 milliliters per hour. Option B, 75 milliliters per hour. Option C, 83 milliliters per hour. Option D, 100 milliliters per hour. Correct answer, C. 2,000 divided by 24, approximately 83 milliliters per hour. A patient with hepatic impairment is prescribed acetaminophen 4 grams a day. What is the best recommendation? Option A, continue as prescribed. Option B, reduce maximum daily dose. Option C, double dose for pain. Option D, take with alcohol. Correct answer B. Hepatic impairment increases risk of toxicity. Lower maximum daily doses are recommended. A patient is prescribed enalapril and spironolactone. What electrolyte abnormality is most concerning? Option A, hyponatremia. Option B, hyperkalemia. Option C, hypocalcemia. Option D, hypermagnesemia. Correct answer, B. Both agents increase potassium levels, risking hyperkalemia. A patient is receiving amphotericin B. Which adverse effect requires monitoring? Option A, hyperglycemia. Option B, nephrotoxicity. Option C, constipation. Option D, weight gain. Correct answer, B. Amphotericin B is known for nephrotoxicity. Renal function and electrolytes must be monitored. A pediatric patient weighs 33 pounds and is prescribed ibuprofen 10 milligrams kilograms dose. What is the dose? Option A, 75 milligrams. Option B, 100 milligrams. Option C, 150 milligrams. Option D, 200 milligrams. Correct answer, C. 33 pounds divided by 2.2 equals 15 kilograms. 10 milligrams per kilogram equals 150 milligrams. A patient is prescribed azathioprine and allopurinol. What is required? Option A, increase azathioprine dose. Option B, decrease azathioprine dose significantly. Option C, no change. Option D, stop allopurinol. Correct answer, B. Allopurinol inhibits azathioprine metabolism, increasing toxicity risk. Dose reduction is required. A medication label reads, refrigerate after reconstitution. What is the best practice? Option A, store at room temperature. Option B, discard after 24 hours. Option C, follow storage instructions to maintain stability. Option D, frozen to extend shelf life. Correct answer, C. Proper storage conditions are essential to maintain drug stability and efficacy. A patient is prescribed clonidine and stops it abruptly. What may occur? Option A, hypoglycemia. Option B, rebound hypertension. Option C, kidney failure. Option D, hypercalcemia. Correct answer, B. Abrupt discontinuation of clonidine can cause rebound hypertension due to sympathetic overactivity. A prescription requires 500 milligrams of a drug available as 125 milligrams per 5 milliliters. How many milliliters are needed? Option A, 10 milliliters. Option B, 15 milliliters. Option C, 20 milliliters. Option D, 25 milliliters. Correct answer, C. 125 milligrams per 5 milliliters, 25 milligrams per milliliter. 500 milligrams divided by 25 milligrams per milliliter equals 20 milliliters. A patient taking warfarin begins eating large amounts of spinach daily. What happens? Option A, increased INR. Option B, decreased INR. Option C, no change. Option D, risk of serotonin syndrome. Correct answer B. Spinach is high in vitamin K, which reduces warfarin effectiveness and lowers INR. A patient with Parkinson's disease is prescribed metoclopramide. What is the concern? Option A, hypotension. Option B, exacerbation of Parkinsonian symptoms. Option C, hyperglycemia. Option D, kidney failure. Correct answer, B. Metoclopramide blocks dopamine receptors and can worsen Parkinson's symptoms. A vial contains 500 milligrams in 10 milliliters. How many milliliters provide 200 milligrams? Option A, 2 milliliters. Option B, 3 milliliters. Option C, 4 milliliters. Option D, 5 milliliters. Correct answer, C. Concentration equals 50 milligrams per milliliter. 200 milligrams divided by 50 milligrams per milliliter. A patient with newly diagnosed pulmonary embolism is prescribed dabigatran. Which instruction is most appropriate regarding initiating therapy? Option A, start dabigatran immediately as monotherapy. Option B, use parenteral anticoagulation for 5 to 10 days before starting dabigatran. Option C, take dabigatran only when symptoms occur. Option D. Take dabigatran with vitamin K to prevent bleeding. Correct answer, B. Dabigatran for treatment of DVT-PE requires initial parenteral anticoagulation for 5 to 10 days prior to starting. It is not initiated as monotherapy for acute DVT-PE treatment. A patient taking tacrolimus after kidney transplant is prescribed fluconazole for oral candidiasis. What is the most appropriate recommendation? Option A, no interaction, dispense as written. Option B, anticipate decreased tacrolimus levels, increase tacrolimus dose. Option C, anticipate increased tacrolimus levels, monitor and adjust dose. Option D, stop tacrolimus for 7 days. Correct answer C. Fluconazole inhibits CYP3A4 and can increase tacrolimus concentrations, raising nephrotoxicity and other toxicity risks. Close level monitoring and dose adjustment are needed. A patient needs 1.5 liters of 0.45% sodium chloride. How many grams of sodium chloride are contained in this volume? Option A, 4.5 grams. Option B, 6.75 grams. Option C, 9.0 grams. Option D, 13.5 grams. Correct answer, B. 0.45% equals 0.45 grams per 100 milliliters. 1.5 liters equals 1,500 milliliters. Amount equals 0.45 grams per 100 milliliters times 1,500 milliliters. 0.45 times 15 equals 6.75 grams. A breastfeeding patient asks if she can take codeine for postpartum pain. What is the best recommendation? Option A, codeine is preferred in breastfeeding. Option B, avoid codeine due to risk of infant opioid toxicity. Consider alternatives. Option C, take codeine only at bedtime and pump and dump for 1 day. Option D, increase dose to reduce duration of therapy. Correct answer B. Codeine can be metabolized to morphine. Ultra-rapid metabolizers may produce high levels, leading to infant sedation, respiratory depression. A patient is started on amiodarone and already takes warfarin. What is the most appropriate management? Option A, stop warfarin permanently. Option B, anticipate increased INR and reduce warfarin dose with close INR monitoring. Option C, increase warfarin dose due to enzyme induction. Option D, no change, monitor INR annually. Correct answer, B. Amiodarone inhibits warfarin metabolism, increasing INR and bleeding risk. Warfarin dose reduction and frequent INR monitoring are required. An IV medication must be administered through a central line due to high osmolarity. Which solution most clearly requires central administration? Option A, 0.9% sodium chloride. Option B, D5W. Option C, total parenteral nutrition, TPN with high dextrose concentration. Option D, lactated ringers. Correct answer C. Hyperosmolar TPN solutions can cause phlebitis and tissue damage if extravasation occurs, so central line administration is typically required. A 72-year-old patient with insomnia asks about diphenhydramine. What is the best counseling? Option A, diphenhydramine is preferred in older adults. Option B, avoid due to anticholinergic effects and fall risk. Option C, take double the dose for better sleep. Option D, take with alcohol for synergy. Correct answer B. Diphenhydramine is anticholinergic and increases confusion, urinary retention, and fall risk in older adults, Beer's criteria. Safer alternatives should be considered. A patient is prescribed oral prednisone for an acute asthma exacerbation. What counseling is most appropriate? Option A, stop immediately once symptoms improve. Option B, take in the morning with food to reduce GI upset and insomnia. Option C, take at bedtime for best effect. Option D, avoid all carbohydrates during therapy. Correct answer B. Morning dosing aligns with cortisol rhythm and reduces insomnia. Taking with food decreases GI upset. Abrupt stoppage depends on duration, but patients should follow prescribed taper if given. A pharmacy receives an order to compound 120 milliliters of an oral solution containing 10 milligrams per milliliter of active drug using powder. How many grams of drug are needed? Option A, 0.12 grams. Option B, 0.6 grams. Option C, 1.2 grams. Option D, 12 grams. Correct answer, C. Total drug equals 10 milligrams per milliliter times 120 milliliters equals 1200 milligrams equals 1.2 grams. A patient has myasthenia gravis and is prescribed ciprofloxacin. What is the primary concern? Option A, severe hypoglycemia. Option B, worsening muscle weakness. Option C, nephrolithiasis. Option D, reduce ciprofloxacin absorption with dairy. Correct answer, B. Fluoroquinolones can exacerbate myasthenia gravis and may cause life-threatening weakness, respiratory failure. Alternative antibiotics are preferred. A patient on a monoamine oxidase inhibitor, MAOI, asks about OTC cold products. Which ingredient should be avoided due to hypertensive crisis risk? Option A, guaifenesin. Option B, pseudoephedrine. Option C, saline nasal spray. Option D, acetaminophen. Correct answer, B. Sympathomimetics like pseudoephedrine can precipitate hypertensive crisis in patients taking MAOIs. Non-sympathomimetic options are preferred. A medication order requires 750 milligrams IV, and the vial concentration is 100 milligrams per milliliter. What volume should be withdrawn? Option A, 5.5 milliliters. Option B, 6.5 milliliters. Option C, 7.5 milliliters. Option D, 8.5 milliliters. Correct answer, C. Volume equals dose divided by concentration. 750 milligrams divided by 100 milligrams per milliliter. A patient with severe hepatic impairment is prescribed rosuvastatin 40 milligrams daily. What is the best recommendation? Option A, continue 40 milligrams. Statins are not hepatically metabolized. Option B, avoid high-dose rosuvastatin. Consider lower dose or alternative with careful monitoring. Option C, add niacin to protect the liver. Option D, double the dose to overcome reduced absorption. Correct answer B. Hepatic impairment can increase statin exposure and adverse effects. High-dose therapy may be inappropriate. Dose reduction, alternative, and monitoring are warranted. A patient receives a prescription for hydroxychloroquine. Which baseline ongoing monitoring is most appropriate to reduce serious toxicity risk? Option A, routine chest X-ray. Option B, Eye exams for retinopathy risk. Option C, daily INR checks. Correct answer, B. Hydroxychloroquine can cause retinal toxicity. Baseline and periodic ophthalmologic exams are recommended based on risk and duration. An IV antibiotic is incompatible with lactated ringers due to calcium content. Which administration strategy best reduces incompatibility risk? Option A, mix antibiotic directly into lactated ringers bag. Option B, administer through the same Y site without flushing. Option C, use a compatible diluent, e.g. 0.9% sodium chloride, and flush the line between medications. Option D, increase infusion rate to reduce contact time. Correct answer, C. Compatibility issues can be mitigated by using a compatible diluent and flushing between infusions, avoiding Y-site co-administration when incompatible. A patient with type 2 diabetes is started on an SGLT2 inhibitor and is fasting for a procedure. Which warning is most important? Option A, risk of ototoxicity. Option B, risk of euglycemic diabetic ketoacidosis. Hold per protocol before surgery. Option C, risk of serotonin syndrome. Option D, risk of severe bradycardia. Correct answer, B. SGLT2 inhibitors can precipitate euglycemic DKA, especially perioperatively or with reduced intake. They are often held several days pre-op per protocol. A patient is prescribed levetiracetam for seizures and asks what to do if a dose is missed. What counseling is best? Option A, double the next dose. Option B, skip and stop therapy if feeling well. Option C, take as soon as remembered unless close to next dose. Do not double. Option D, take only when aura occurs. Correct answer, C. Standard missed dose counseling reduces risk of toxicity and maintains control. Take when remembered, unless near next dose. Do not double. A patient needs potassium phosphate providing 30 millimole of phosphate. The product contains 3 millimole per milliliter. How many milliliters are required? Option A, 5 milliliters. Option B, 8 milliliters. Option C, 10 milliliters. Correct answer, C. Volume equals 30 millimole divided by 3 millimole per millimole equals 10 millimole. A patient with a mechanical heart valve asks if they can switch from warfarin to a direct oral anticoagulant for convenience. What is the best recommendation? Option A, yes, direct oral anticoagulants are preferred. Option B, yes, switch to any DOAC at standard dose. Option C, no. Warfarin remains the recommended therapy for mechanical valves. Option D, switch to aspirin alone. Correct answer, C. DOACs are not recommended for patients with mechanical heart valves. Warfarin remains standard due to efficacy and safety evidence. A patient is prescribed clozapine. Which monitoring requirement is essential before dispensing? Option A, monthly liver ultrasound. Option B, absolute neutrophil count. ANC monitoring per REMS. Option C, daily INR monitoring. Option D, serum potassium monitoring only. Correct answer, B. Clozapine carries risk of severe neutropenia, agranulocytosis, and requires ANC monitoring under a REMS program before dispensing and during therapy. A patient on chronic hemodialysis is prescribed gabapentin for neuropathic pain. What is most appropriate? Option A, use standard dosing with no adjustment. Option B, avoid gabapentin because it is hepatically cleared. Option C, dose adjust and consider post-dialysis dosing due to renal elimination. Option D, increase dose because dialysis removes all drug instantly. Correct answer. C. Gabapentin is renally eliminated and requires significant dose adjustment in ESRD, often dosed after dialysis sessions to maintain therapeutic levels. A patient with allergic rhinitis asks about using intranasal corticosteroids. Which counseling point is best? Option A. Use only for immediate relief within minutes. Option B. Aim spray away from the nasal septum to reduce irritation epistaxis. Option C. Stop after 2 days to prevent dependence. Option D. Rinse mouth after use to prevent thrush. Correct answer B. Proper technique includes directing spray away from septum to reduce bleeding, irritation. Intranasal steroids have delayed onset, days, and mouth rinsing is more relevant to inhaled steroids. A prescription calls for 1 to 1,000 epinephrine. The vial is labeled 1 mg per milliliter. What is the equivalent concentration? Option A, 0.1 mg per milliliter. Option B, 0.5 mg per milliliter. Option C, 1 mg per milliliter. Option D, 10 mg per milliliter. Correct answer C. 1 to 1,000 means 1 gram in 1,000 milliliters equals 1,000 milligrams over 1,000 milliliters equals 1 milligram per milliliter. A patient is prescribed rifampin for tuberculosis and takes a combined oral contraceptive. What is the best recommendation? Option A, no change, contraceptive efficacy is unaffected. Option B, use additional non-hormonal contraception during rifampin therapy. Option C, increase oral contraceptive dose without prescriber input. Option D, take both medications with grapefruit juice. Correct answer, B. Rifampin is a potent enzyme inducer that reduces hormonal contraceptive effectiveness. Backup contraception is recommended. A patient is prescribed denosumab. Which supplementation/monitoring is most important? Option A, vitamin K supplementation. Option B, calcium and vitamin D, monitor for hypocalcemia. Option C, high-protein diet, monitor triglycerides. Option D, iron supplementation, monitor ferritin. Correct answer, B. Denosumab can cause hypocalcemia, especially in renal impairment. Adequate calcium/vitamin D and monitoring are important. A chemotherapy order includes vincristine. Which safety practice is critical to prevent fatal medication errors? Option A, dispense vincristine in a syringe for IV push in any setting. Option B, ensure vincristine is never administered intrathecally. Use labeling and separate storage. Option C, mix vincristine with intrathecal methotrexate for efficiency. Option D, administer via intramuscular injection. Correct answer B. Intrathecal vincristine administration is fatal. High alert safeguards include prominent warnings, separation from intrathecal meds, and strict process controls. A patient is prescribed oral iron and levothyroxine. How should these be taken? Option A, together to improve iron absorption. Option B, iron should be taken with levothyroxine to stabilize thyroid levels. Option C, separate doses by at least 4 hours to avoid reduced levothyroxine absorption. Option D, alternate days to prevent interactions. Correct answer, C. Iron binds levothyroxine and reduces absorption. Separating by several hours, commonly 4, improves efficacy. A patient needs to receive 12 milligrams of a medication, and the available concentration is 2 milligrams per milliliter. The dose is to be diluted to a total volume of 50 milliliters. How many milliliters of drug solution are needed? Option A, 4 milliliters. Option B, 6 milliliters. Option C, 8 milliliters. Correct answer, B. Volume of drug equals 12 milligrams divided by 2 milligrams per milliliter equals 6 milliliters. Then add diluent to reach 50 milliliters total. The correct volume withdrawn is 6 milliliters. The correct answer choice should be B, not D. Note, the options include B, 6 milliliters, which is correct. Volume equals dose divided by concentration equals 12 milligrams divided by 2 milligrams per milliliter equals 6 milliliters. Then dilute with 44 milliliter diluent to total 50 milliliters. A patient with acute angle closure glaucoma asks about using an OTC sleep aid containing diphenhydramine. What is the best recommendation? Option A, safe, no precautions needed. Option B, avoid due to anticholinergic effects that can worsen glaucoma. Option C, take double dose for faster sleep onset. Option D, is only with grapefruit juice. Correct answer, B. Anticholinergic agents can precipitate worsen angle closure glaucoma by increasing intraocular pressure. Avoid and recommend alternatives. A patient receiving gentamicin IV develops tinnitus. What is the most appropriate action? Option A, reassure. Tinnitus is expected and benign. Option B, continue therapy and add a diuretic. Option C, contact provider. Ototoxicity is possible and therapy and levels should be reassessed. Option D, increase gentamicin dose to overcome resistance. Correct answer, C. Aminoglycosides can cause ototoxicity, tinnitus, hearing loss. This warrants prompt evaluation, drug level assessment, and potential therapy modification. A patient with ulcerative colitis is prescribed mesalamine delayed-release tablets. Which counseling point is most important? Option A, crush tablets before taking. Option B, take with antacids to improve absorption. Option C, swallow tablets whole, do not crush or chew. Option D, take only during symptom flares. Correct answer, C. Delayed-release mesalamine tablets are designed to release drug in the intestine. Crushing or chewing destroys the delivery mechanism and reduces effectiveness. A patient receiving linezolid is started on tramadol for pain. What is the primary concern? Option A, QT prolongation. Option B, serotonin syndrome. Option C, severe hypoglycemia. Option D, renal toxicity. Correct answer, B. Linezolid is a reversible MAOI, and tramadol has serotonergic activity, increasing the risk of serotonin syndrome when used together. A solution contains 15 milligrams per milliliter of drug. How many milliliters are required to administer a 375 milligram dose? Option A, 15 milliliters. Option B, 20 milliliters. Option C, 25 milliliters. Option D, 30 milliliters. Correct answer, C. Volume equals dose divided by concentration equals 375 milligrams divided by 15 milligrams per milliliter, 25 milliliters. A patient with heart failure is prescribed eplerenone and is already taking lisinopril. What should be monitored closely? Option A, sodium levels. Option B, potassium levels. Option C, blood glucose. Option D, INR. Correct answer, B. Both ACE inhibitors and aldosterone antagonists increase potassium levels, raising the risk of hyperkalemia. A patient with epilepsy stabilized on carbamazepine begins doxycycline therapy. What is expected? Option A, increased doxycycline levels. Option B, decreased doxycycline effectiveness due to enzyme induction. Option C, no interaction. Option D, increased risk of serotonin syndrome. Correct answer, B. Carbamazepine is a strong enzyme inducer and can decrease doxycycline concentrations, reducing effectiveness. An IV medication is known to adsorb to PVC tubing. Which action reduces drug loss? Option A, increase infusion rate. Option B, use non-PVC tubing. Option C, dilute in lactated ringers. Option D, refrigerate before use. Correct answer, B. Some drugs bind to PVC tubing. Using non-PVC tubing reduces absorption and ensures accurate dosing. A 5-year-old child weighing 18 kilograms is prescribed azithromycin 10 milligrams per kilogram on day 1. What is the dose? Option A, 120 milligrams. Option B, 150 milligrams. Option C, 180 milligrams. Option D, 200 milligrams. Correct answer, C. 10 milligrams per kilogram times 18 kilograms equals 180 milligrams. A patient taking topiramate reports tingling in fingers and confusion. What is the likely cause? Option A, hyperkalemia. Option B, metabolic acidosis. Option C, hyperglycemia. Option D, hyponatremia. Correct answer, B. Topiramate can cause metabolic acidosis due to carbonic anhydrase inhibition, leading to paresthesia and confusion. A patient is prescribed a transdermal fentanyl patch. Which instruction is most appropriate? Option A, apply heating pad over patch for better absorption. Option B, change patch every 24 hours. Option C, avoid exposing patch to heat sources. Option D, cut patch in half if dose seems high. Correct answer, C. Heat increases fentanyl absorption and can cause overdose. Patches must not be cut and are typically changed every 72 hours. A patient receives a prescription for metronidazole. What counseling point is critical? Option A, avoid dairy products. Option B, avoid alcohol during therapy and for several days after. Option C, take only at bedtime. Option D, double dose if a dose is missed. Correct answer, B. Metronidazole can cause a disulfiram-like reaction with alcohol, leading to severe nausea and vomiting. A pharmacy prepares an IV admixture that requires 2 milligrams per milliliter in a 100 milliliter bag. How many milligrams of drug are needed? Option A, 100 milligrams. Option B, 150 milligrams. Option C, 200 milligrams. Option D, 250 milligrams. Correct answer, C, 2 milligrams per milliliter times 100 milliliters equals 200 milligrams. A patient with gout is prescribed probenecid and begins taking penicillin for infection. What happens? Option A, penicillin levels decrease. Option B, penicillin levels increase due to reduced renal excretion. Option C, no interaction. Option D, increased risk of serotonin syndrome. Correct answer, B. Probenecid inhibits renal tubular secretion of penicillin, increasing its levels. A patient is prescribed ondansetron and also takes methadone. What is the concern? Option A, hyperkalemia. Option B, QT prolongation. Option C, renal failure. Option D, hypoglycemia. Correct answer, B. Both drugs can prolong QT interval, increasing risk of arrhythmias. A medication must be stored frozen until use. What is the best practice? Option A, store at room temperature for convenience. Option B, follow storage requirements to maintain stability and efficacy. Option C, refrigerate instead of freezing. Option D, warm before storing. Correct answer B. Following manufacturer's storage instructions is critical to preserve stability and effectiveness. A patient weighing 90 kilograms is prescribed enoxaparin 1.5 milligrams per kilogram once daily. What is the dose? Option A, 100 milligrams. Option B, 120 milligrams. Option C, 135 milligrams. Option D, 150 milligrams. Correct answer C. 1.5 milligrams per kilogram times 90 kilograms equals 135 milligrams. A patient with BPH is prescribed oxybutynin for bladder spasms. What is the concern? Option A, hypoglycemia. Option B, urinary retention worsening. Option C, kidney failure. Option D, increased INR. Correct answer B. Anticholinergic agents like oxybutynin can worsen urinary retention in patients with BPH. A patient taking levodopa-carbidopa is started on a high-protein diet. What is expected? Option A, increased levodopa absorption. Option B, reduced levodopa effectiveness due to competition for absorption. Option C, no effect. Option D, increased serotonin syndrome risk. Correct answer, B. Amino acids compete with levodopa for transport across the gut and blood-brain barrier, reducing effectiveness. A solution contains 500 milligrams in 50 milliliters. What is the concentration? Option A, 5 milligrams per milliliter. Option B, 8 milligrams per milliliter. Option C, 10 milligrams per milliliter. Correct answer, C. 500 milligrams divided by 50 milliliters equals 10 milligrams per milliliter. A patient on chronic opioid therapy is prescribed naloxone. What is the primary counseling point? Option A, use naloxone daily. Option B, Use naloxone only if overdose signs occur. Option C. Store naloxone in freezer. Option D. Take naloxone with meals. Correct answer, B. Naloxone is for emergency use in opioid overdose and should be used when signs of overdose are present. A patient with hypothyroidism is prescribed sucralfate for ulcers. What is the concern? Option A. Increased thyroid hormone levels.
Option B. Reduced levothyroxine absorption.
Option C. Risk of serotonin syndrome. Option D. Increased blood pressure. Correct answer, B. Sucralfate binds levothyroxine and reduces absorption. Doses should be separated. A patient is prescribed chlorpromazine and experiences muscle rigidity and fever. What is suspected? Option A. Serotonin syndrome. Option B. Neuroleptic malignant syndrome. Option C. Hypoglycemia. Option D. Anaphylaxis. Correct answer, B. Chlorpromazine can cause neuroleptic malignant syndrome, characterized by rigidity, fever, and autonomic instability. A patient needs 250 milliliters of IV fluid over 30 minutes. What is the rate in milliliters per hour? Option A, 250 milliliters per hour. Option B, 300 milliliters per hour. Option C, 400 milliliters per hour. Option D, 500 milliliters per hour. Correct answer, D, 250 milliliters in 0.5 hour. 250 divided by 0.5 equals 500 milliliters per hour. A patient with rheumatoid arthritis is prescribed leflunomide. Which counseling is important? Option A, safe in pregnancy. Option B, requires pregnancy avoidance due to teratogenicity. Option C, no liver monitoring required. Option D, take with grapefruit juice. Correct answer, B. Leflunomide is teratogenic and requires strict pregnancy avoidance and monitoring. A patient on verapamil is prescribed simvastatin 80 milligrams. What is the concern? Option A, reduced simvastatin levels. Option B, increased risk of myopathy, rhabdomyolysis. Option C, hyperkalemia. Option D, hypoglycemia. Correct answer, B. Verapamil inhibits simvastatin metabolism, increasing statin levels and risk of muscle toxicity. A pharmacy compounds a suspension with 250 milligrams in 100 milliliters. What is the concentration? Option A, 1.5 milligrams per milliliter. Option B, 2.5 milligrams per milliliter. Option C, 5 milligrams per milliliter. Option D, 10 milligrams per milliliter. Correct answer, B. 250 milligrams divided by 100 ml equals 2.5 milligrams per milliliter. A patient with GERD is prescribed aluminum hydroxide and ciprofloxacin. What counseling is needed? Option A, take together for best effect. Option B, separate doses by several hours to avoid reduced ciprofloxacin absorption. Option C, double ciprofloxacin dose. Correct answer, B, Aluminum binds ciprofloxacin and reduces absorption. Doses should be separated. A patient taking phenelzine asks about eating aged cheese. What is the risk? Option A, hypoglycemia. Option B, hypertensive crisis. Option C, kidney failure. Option D, liver toxicity. Correct answer, B. Tyramine-rich foods with MAOIs can cause hypertensive crisis. A patient requires 900 milligrams of medication. The vial contains 300 milligrams per 5 milliliters. How many milliliters are needed? Option A, 10 milliliters. Option B, 12 milliliters. Option C, 15 milliliters. Correct answer, C. 300 milligrams per 5 milliliters. 60 milligrams per milliliter. 900 milligrams divided by 60 milligrams per milliliter equals 15 milliliters. A patient with angle closure glaucoma is prescribed ipratropium inhaler. What is the concern? Option A, hypoglycemia. Option B, worsening glaucoma due to anticholinergic effect. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Anticholinergic inhalers can increase intraocular pressure and worsen angle closure glaucoma. A patient on tobramycin IV develops decreased urine output. What is the best action? Option A, continue therapy. Option B, increase dose. Option C, notify provider. Assess for nephrotoxicity. Option D, add diuretic. Correct answer, C. Aminoglycosides can cause nephrotoxicity. Reduced urine output warrants immediate evaluation and possible therapy adjustment. A patient with chronic kidney disease, CRCL 18 milliliters per minute, is prescribed nitroprusside IV for hypertensive emergency. What is the primary concern with prolonged use? Option A, hyperkalemia. Option B, cyanide thiocyanate toxicity accumulation. Option C, severe hypoglycemia. Option D, ototoxicity. Correct answer B. Nitroprusside metabolizes to cyanide and thiocyanate, which can accumulate in renal impairment, increasing toxicity risk with prolonged infusion. A patient taking sirolimus after transplant is prescribed erythromycin. What is the best action? Option A, continue therapy without change. Option B, anticipate decreased sirolimus levels. Option C, anticipate increased sirolimus levels and monitor closely. Option D, stop sirolimus immediately. Correct answer C. Erythromycin inhibits CYP3A4, increasing sirolimus concentrations and toxicity risk. Close monitoring and dose adjustment are required. A medication is available as 250 milligrams in 2 milliliters. How many milliliters are required for a 625 milligram dose? Option A, 4 milliliters. Option B, 5 milliliters. Option C, 6 milliliters. Correct answer, B. 250 milligrams per 2 milliliters, 125 milligrams per milliliter. 625 milligrams divided to 125 milligrams per milliliter. A patient in the third trimester of pregnancy asks about taking ibuprofen for pain. What is the best recommendation? Option A, safe throughout pregnancy. Option B, avoid due to risk of premature ductus arteriosus closure. Option C, take only at bedtime. Option D, double dose for faster relief. Correct answer, B. NSAIDs in the third trimester can cause premature closure of the ductus arteriosus and other fetal risks. A patient taking phenytoin begins therapy with sulfamethoxazole, trimethoprim. What is the concern? Option A, decreased phenytoin levels. Option B, increased phenytoin levels and toxicity risk. Option C, no interaction. Option D, increased risk of serotonin syndrome. Correct answer, B. TMPSMX inhibits phenytoin metabolism, increasing levels and toxicity risk, nystagmus, ataxia, confusion. An IV medication is labeled "do not shake." What is the primary reason? Option A, shaking increases potency. Option B, shaking can cause foaming or denaturation of the drug. Option C, shaking reduces contamination. Option D, shaking changes color only. Correct answer, B. Some IV medications are sensitive to agitation, which can cause denaturation, foaming, or instability. A pediatric patient weighs 11 kilograms and is prescribed clindamycin 10 milligrams kilograms per dose every 8 hours. What is the dose per administration? Option A, 90 milligrams. Option B, 100 milligrams. Option C, 110 milligrams. Option D, 120 milligrams. Correct answer, C. 10 milligrams per kilogram times 11 kilograms equals 110 milligrams per dose. A patient on chronic alcohol use is prescribed disulfiram. What counseling is critical? Option A, drink alcohol only with meals. Option B, avoid all alcohol-containing products, including mouthwash and cough syrups. Option C, double the dose if craving alcohol. Option D, stop medication after 3 days. Correct answer, B. Disulfiram causes severe reaction with alcohol. Patients must avoid all alcohol sources, including OTC products. A patient using a transdermal clonidine patch reports the patch fell off after 12 hours. What should they do? Option A, apply 2 new patches. Option B, reapply the same patch if adhesive remains, or apply a new patch and continue schedule. Option C, skip dose for the day. Option D, take oral clonidine instead without guidance. Correct answer, B. If the patch falls off, it can be reapplied if adhesive is intact. Otherwise, apply a new patch and maintain schedule. A compounded sterile product requires filtration. Which filter size removes bacteria? Option A, 5 micron. Option B, 1 micron. Option C, 0.45 micron. Option D, 0.22 micron. Correct answer D. A 0.22 micron filter is used to sterilize solutions by removing bacteria during sterile compounding. A patient is prescribed diltiazem and reports dizziness and slow heart rate. What is the likely cause? Option A, hyperglycemia. Option B, bradycardia from calcium channel blockade. Option C, kidney failure. Correct answer, B. Diltiazem slows AV conduction, and can cause bradycardia, dizziness, and hypotension. A solution contains 1 gram of drug in 250 milliliters. What is the concentration in milligrams per milliliter? Option A, 2 milligrams per milliliter. Option B, 4 milligrams per milliliter. Option C, 5 milligrams per milliliter. Option D, 10 milligrams per milliliter. Correct answer, B. 1 gram equals 1,000 milligrams. 1,000 milligrams divided by 250 milliliters equals 4 milligrams per milliliter. A patient on chronic corticosteroids is prescribed a live attenuated vaccine. What is the best recommendation? Option A, safe administer vaccine. Option B, avoid live vaccine due to immunosuppression. Option C, double steroid dose. Option D, stop steroids abruptly. Correct answer, B. Immunosuppressed patients should generally avoid live vaccines due to infection risk. A patient taking gemfibrozil is prescribed atorvastatin. What is the concern? Option A, reduced statin effectiveness. Option B, increased risk of myopathy and rhabdomyolysis. Option C, hyperkalemia. Option D, hypoglycemia. Correct answer, B. Gemfibrozil increases statin levels, raising risk of muscle toxicity. A pharmacy prepares 300 milliliters of a 1.5% WV solution. How many grams of drug are present? Option A, 3g. Option B, 4.5g. Option C, 6g. Correct answer, B. 1.5% equals 1.5 grams per 100 milliliters. For 300 milliliters, 1.5 times 3 equals 4.5 grams. A patient with COPD is prescribed roflumilast. What is an important counseling point? Option A, use for acute bronchospasm. Option B, may cause weight loss and psychiatric symptoms. Option C, take only when symptomatic. Option D, double dose if shortness of breath occurs. Correct answer, B. Roflumilast can cause weight loss, insomnia, anxiety, and depression. Patients should be counseled accordingly. A patient taking warfarin is prescribed cranberry supplements. What is the concern? Option A, decreased INR. Option B, increased INR and bleeding risk. Option C, no interaction. Option D, hypoglycemia. Correct answer, B. Cranberry may increase warfarin effect and INR, increasing bleeding risk. A medication requires dilution to 50 milliliters total volume. If 8 milliliters of drug is used, how much diluent is needed? Option A, 32 milliliters. Option B, 40 milliliters. Option C, 42 milliliters. Option D, 48 milliliters. Correct answer, C. 50 milliliters total minus 8 milliliters drug equals 42 milliliters diluent. A patient with glaucoma is prescribed a scopolamine patch for motion sickness. What is the concern? Option A, hypoglycemia. Option B, worsening intraocular pressure. Option C, kidney failure. Option D, hyperkalemia. Correct answer B. Anticholinergic drugs can increase intraocular pressure and worsen glaucoma. A patient receiving amphotericin B lipid complex develops chills and fever during infusion. What is the best management? Option A, stop therapy permanently. Option B, premedicate with acetaminophen and antihistamines for future doses. Option C, double infusion rate. Option D, add diuretic. Correct answer, B. Infusion-related reactions are common. Premedication reduces symptoms without stopping therapy.
A patient is prescribed risagaline for Parkinson's disease
And asks about dextromethorphan cough syrup. What is the concern? Option A, kidney failure. Option B, serotonin syndrome risk. Option C, hypoglycemia. Option D, hyperkalemia. Correct answer B. Rasagilinine is an MAO-B inhibitor and can increase risk of serotonin syndrome with serotonergic agents like dextromethorphan. A vial contains 2 grams in 20 milliliters. How many milliliters are needed for a 600 milligram dose? Option A, 4 milliliters. Option B, 5 milliliters. Option C, 6 milliliters. Correct answer, C. 2 grams equals 2,000 milligrams. 2,000 milligrams divided by 20 milliliters equals 100 milligrams per mil. 600 milligrams divided by 100 milligrams per mil equals 6 milliliters. A patient with renal impairment is prescribed morphine for pain. What is the concern? Option A, hypoglycemia. Option B, accumulation of active metabolites causing toxicity. Option C, liver failure. Option D, hyperkalemia. Correct answer, B. Morphine metabolites accumulate in renal impairment, increasing risk of sedation and respiratory depression. A patient uses a metered-dose inhaler, MDI. Which technique is correct? Option A, inhale rapidly and deeply, immediately. Option B, exhale, actuate inhaler at start of slow inhalation, hold breath 10 seconds. Option C, spray into mouth without inhaling. Option D, use without shaking. Correct answer B. Proper MDI technique ensures medication reaches lungs effectively. A compounded preparation requires 3% WV in 150 milliliters. How many grams of drug are needed? Option A, 3g. Option B, 4.5g. Option C, 6g. Option D, 9g. Correct answer B. 3% equals 3 grams 100 milliliters. For 150 milliliters, 3 times 1.5 equals 4.5 grams. A patient taking digoxin develops nausea and visual disturbances. What is the likely issue? Option A, hypoglycemia. Option B, digoxin toxicity. Option C, kidney failure. Option D, serotonin syndrome. Correct answer, B. Classic digoxin toxicity signs include nausea, vomiting, and visual disturbances. Yellow-green halos. A patient is prescribed isoniazid. Which supplement should be recommended? Option A, vitamin C. Option B, vitamin B6, pyridoxine. Option C, vitamin D. Option D, iron. Correct answer B. Isoniazid can cause peripheral neuropathy by depleting pyridoxine. A solution contains 750 milligrams in 30 milliliters. What is the concentration? Option A, 15 milligrams per milliliter. Option B, 20 milligrams per milliliter. Option C, 25 milligrams per milliliter. Option D, 30 milligrams per milliliter. Correct answer C. 750 milligrams divided by 30 milliliters equals 25 milligrams per milliliter. A patient with atrial fibrillation asks about using St. John's wort with apixaban. What is the concern? Option A, increased bleeding risk. Option B, reduced apixaban effectiveness due to enzyme induction. Option C, no interaction. Option D, hypoglycemia. Correct answer B. St. John's wort induces drug metabolizing enzymes and can reduce apixaban levels, increasing clot risk. A patient receiving vancomycin develops red flushing of the upper body during infusion. What is the most appropriate action? Option A, stop therapy permanently. Option B, slow infusion rate and consider antihistamines. Option C, increase infusion rate. Option D, add corticosteroids. Correct answer B. Redman syndrome is infusion-related. Slowing infusion and pre-medicating with antihistamines can prevent recurrence. A patient with atrial fibrillation and severe renal impairment, CRCL 12 milliliters minute, is prescribed edoxaban. What is the best recommendation? Option A, continue edoxaban at standard dose. Option B, increase edoxaban dose. Option C, avoid edoxaban, consider alternative anticoagulation. Option D, take edoxaban every other day. Correct answer C. Edoxaban is not recommended in severe renal impairment due to altered clearance and bleeding risk. Alternative anticoagulation strategies should be considered. A patient taking cyclosporine is prescribed ketoconazole. What is the primary concern? Option A, decrease cyclosporine levels. Option B, increase cyclosporine levels and nephrotoxicity risk. Option C, no interaction. Option D, hypoglycemia. Correct answer B. Ketoconazole inhibits CYP3A4, increasing cyclosporin levels and raising nephrotoxicity risk. A solution contains 40 milligrams per milliliter. How many milliliters are needed for a 1.2 gram dose? Option A, 20 milliliters. Option B, 25 milliliters. Option C, 30 milliliters. Option D, 35 milliliters. Correct answer C. 1.2 G equals 1200 milligrams. 1200 milligrams divided by 40 milligrams per milliliter equals 30 milliliters. A pregnant patient, first trimester, is prescribed enalapril. What is the best action? Option A, continue enalapril. Option B, switch to a safer alternative due to teratogenic risk. Option C, double the dose. Option D, take only at bedtime. Correct answer B. ACE inhibitors are teratogenic, especially in the first trimester. A safer alternative is required. A patient on phenobarbital is prescribed doxycycline. What is expected? Option A, increased doxycycline levels. Option B, reduced doxycycline effectiveness due to enzyme induction. Option C, no interaction. Option D, increased risk of serotonin syndrome. Correct answer, B. Phenobarbital is a strong enzyme inducer and reduces doxycycline levels, decreasing effectiveness. An IV medication requires protection from light during infusion. What is the best practice? Option A, use a clear IV bag. Option B, cover tubing in bag with light protective material. Option C, increase infusion rate. Option D, refrigerate during infusion. Correct answer, B. Light-sensitive medications must be shielded from light to maintain stability. A pediatric patient weighs 14 kilograms and is prescribed gentamicin 2.5 milligrams kilograms per dose. What is the dose? Option A, 25 milligrams. Option B, 30 milligrams. Option C, 35 milligrams. Option D, 40 milligrams. Correct answer, C, 2.5 milligrams kilogram times 14 kilograms equals 35 milligrams. A patient on chronic corticosteroids is scheduled to receive a varicella vaccine. What is the best recommendation? Option A, safe to administer. Option B, avoid live vaccine due to immunosuppression. Option C, increase steroid dose. Option D, delay vaccine for 24 hours only. Correct answer, B. Varicella is a live vaccine and should be avoided in immunosuppressed patients on chronic steroids. A patient is prescribed desmopressin and reports headache and confusion. What is the likely cause? Option A, hyperkalemia. Option B, hyponatremia due to water retention. Option C, hypoglycemia. Option D, kidney stones. Correct answer, B. Desmopressin can cause water retention and dilutional hyponatremia, leading to neurologic symptoms. A compounded sterile product must be prepared using aseptic technique. Which environment is required? Option A, open countertop. Option B, laminar airflow hood or biological safety cabinet. Option C, patient room. Option D, refrigerator. Correct answer, B. Sterile compounding requires controlled environments such as laminar airflow hoods or biological safety cabinets. A patient taking propranolol reports fatigue and cold extremities. What is the likely cause? Option A, hyperglycemia. Option B, reduced peripheral circulation from beta blockade. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Beta blockers reduce cardiac output and peripheral circulation, causing cold extremities and fatigue. A solution contains 600 milligrams in 15 milliliters. What is the concentration? Option A, 20 milligrams per milliliter. Option B, 30 milligrams per milliliter. Option C, 40 milligrams per milliliter. Option D, 50 milligrams per milliliter. Correct answer C, 600 milligrams divided by 15 milliliters equals 40 milligrams per milliliter. A patient with rheumatoid arthritis is prescribed sulfasalazine. Which monitoring is important? Option A, eye exams. Option B, complete blood counts due to risk of bone marrow suppression. Option C, blood glucose levels. Option D, INR. Correct answer, B. Sulfasalazine can cause bone marrow suppression. Periodic CBC monitoring is recommended. A patient taking nifedipine asks about drinking grapefruit juice. What is the best advice? Option A, safe to consume. Option B, avoid grapefruit juice due to increased drug levels. Option C, double nifedipine dose. Option D, take only at bedtime. Correct answer, B. Grapefruit juice inhibits CYP3A4 and increases nifedipine levels, risking hypotension. A pharmacy prepares 500 milliliters of a 0.8% WV solution. How many grams of drug are present? Option A, 2 grams. Option B, 3 grams. Option C, 4 grams. Correct answer, C. 0.8 grams per 100 milliliters times 500 milliliters equals 4 grams. A patient with asthma is prescribed aspirin for pain. What is the concern? Option A, hypoglycemia. Option B, aspirin-exacerbated respiratory disease, bronchospasm. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Aspirin can trigger bronchospasm in susceptible asthmatic patients. A patient on levothyroxine is prescribed cholestyramine. What is the counseling point? Option A, take together. Option B, separate doses by several hours. Option C, double levothyroxine dose. Option D, take with grapefruit juice. Correct answer, B. Cholestyramine binds levothyroxine and reduces absorption. Doses must be separated. A patient requires 2.4 grams of medication. The vial contains 400 milligrams per 5 milliliters. How many milliliters are needed? Option A, 20 milliliters. Option B, 25 milliliters. Option C, 30 milliliters. Option D, 35 milliliters. Correct answer, C. 400 milligrams per 5 milliliters is 80 milligrams per milliliter. 2,400 milligrams divided by 80 milligrams per milliliter equals 30 milliliters. A patient with BPH is prescribed diphenhydramine for allergies. What is the concern? Option A, hypoglycemia. Option B, urinary retention due to anticholinergic effect. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Anticholinergic drugs worsen urinary retention in BPH. A patient receiving amphotericin B deoxycholate develops hypokalemia. What should be monitored? Option A, blood glucose. Option B, potassium levels. Option C, INR. Option D, liver enzymes. Correct answer, B. Amphotericin B commonly causes hypokalemia and electrolyte disturbances. A patient is prescribed pramipexole for Parkinson's disease. What adverse effect should be discussed? Option A, hyperglycemia. Option B, impulse control disorders. Option C, kidney stones. Option D, hyperkalemia. Correct answer, B. Dopamine agonists like pramipexole can cause impulse control disorders, gambling, shopping, etc. A solution contains 900 milligrams in 45 milliliters. What is the concentration? Option A, 10 milligrams per milliliter. Option B, 15 milligrams per milliliter. Option C, 20 milligrams per milliliter. Option D, 25 milligrams per milliliter. Correct answer, C. 900 milligrams divided by 45 milliliters, 20 milligrams per mil. A patient is prescribed warfarin and amoxicillin. What is the likely effect? Option A, decreased INR. Option B, increased INR due to altered gut flora. Option C, no change. Option D, hypoglycemia. Correct answer, B. Antibiotics can reduce vitamin K producing gut flora, increasing INR. A patient with glaucoma is prescribed glycopyrrolate. What is the concern? Option A, hypoglycemia. Option B, increased intraocular pressure. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Anticholinergics can increase intraocular pressure and worsen glaucoma. A pharmacy compounds 250 milliliters of a 4% WV solution. How many grams of drug are present? Option A, 5G. Option B, 8G. Option C, 10G. Option D, 12G. Correct answer, C. 4 grams per 100 milliliters times 250 milliliters equals 10 grams. A patient with depression is prescribed venlafaxine and reports high blood pressure. What is the cause? Option A, hypoglycemia. Option B, dose-related hypertension from SNRI effect. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Venlafaxine can increase blood pressure, especially at higher doses. A patient taking carbimazole develops fever and sore throat. What is the concern? Option A, hypoglycemia. Option B, agranulocytosis. Option C, kidney stones. Option D, hyperkalemia. Correct answer, B. Carbimazole can cause agranulocytosis. Fever, sore throat are warning signs requiring immediate evaluation. A patient requires 180 milligrams of drug. The concentration is 30 milligrams per milliliter. How many milliliters are needed? Option A, 4 milliliters. Option B, 5 milliliters. Option C, 6 milliliters. Option D, 7 milliliters. Correct answer, C. 180 milligrams divided by 30 milligrams per milliliter equals 6 milliliters. A patient on chronic opioid therapy is prescribed gabapentin. What is the concern? Option A, hyperglycemia. Option B,
increased risk of CNS depression and respiratory depression. Option C, kidney failure. Option D, hyperkalemia. Correct answer. B. Combined CNS depressants increase risk of sedation and respiratory depression. A patient receiving IV acyclovir develops flank pain and elevated creatinine. What is the likely cause? Option A, hyperkalemia. Option B, crystal nephropathy from inadequate hydration. Option C, hypoglycemia. Option D, liver failure. Correct answer B. Acyclovir can crystallize in renal tubules, causing nephropathy. Adequate hydration and dose adjustment are important. A patient with a history of heparin-induced thrombocytopenia, HIT, requires anticoagulation for DVT. Which medication is most appropriate? Option A, unfractionated heparin. Option B, enoxaparin. Option C, argatroban. Option D, warfarin monotherapy initially. Correct answer, C. Argatroban is a direct thrombin inhibitor used in patients with HIT. Heparin and LNWH are contraindicated. Warfarin alone initially is unsafe in HIT. A patient taking everolimus after transplant is prescribed clarithromycin. What is the primary concern? Option A, reduced everolimus levels. Option B, increased everolimus levels and toxicity. Option C, no interaction. Option D, hypoglycemia. Correct answer, B. Clarithromycin inhibits CYP3A4, increasing everolimus levels and risk of toxicity. A solution contains 75 milligrams per milliliter. How many milliliters are required for a 900 milligram dose? Option A, 8 milliliters. Option B, 10 milliliters. Option C, 12 milliliters. Correct answer, C. Volume equals 900 milligrams divided by 75 milligrams per milliliter. A patient in the second trimester of pregnancy asks about taking isotretinoin for acne. What is the best response? Option A, safe after first trimester. Option B, avoid due to severe teratogenic risk. Option C, take only at bedtime. Option D, reduce dose by half. Correct answer, B. Isotretinoin is highly teratogenic at any stage of pregnancy and must be avoided. A patient stabilized on valproic acid begins taking rifampin. What is expected? Option A, increased valproic acid levels. Option B, decreased valproic acid levels due to enzyme induction. Option C, no interaction. Option D, increased risk of serotonin syndrome. Correct answer, B. Rifampin is a potent enzyme inducer that decreases valproic acid levels, risking seizure breakthrough. An IV medication is known to precipitate when mixed with dextrose solutions. What is the best practice? Option A, dilute in D5W. Option B, use a compatible diluent, such as normal saline. Option C, increase infusion speed. Option D, store at room temperature. Correct answer, B. Using a compatible diluent prevents precipitation and ensures safe administration. A pediatric patient weighs 9 kilograms and is prescribed ceftriaxone 50 milligrams per kilogram per day. What is the total daily dose? Option A, 350 milligrams. Option B, 400 milligrams. Option C, 450 milligrams. Option D, 500 milligrams. Correct answer, C. 15 milligrams per kilogram times 9 kilograms equals 450 milligrams per day. A patient on chronic benzodiazepine therapy abruptly stops the medication. What is the risk? Option A, hypoglycemia. Option B, withdrawal seizures. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Abrupt benzodiazepine discontinuation can cause withdrawal seizures and should be tapered. A patient using a nicotine patch reports vivid dreams. What is the best counseling? Option A, stop therapy. Option B, remove patch at bedtime to reduce dreams. Option C, apply 2 patches. Option D, take with food. Correct answer, B. Removing the patch at bedtime can reduce sleep disturbances and vivid dreams. A sterile compounded product requires terminal sterilization. Which method is appropriate? Option A, boiling water. Option B, autoclaving, steam sterilization. Option C, freezing. Option D, UV light only. Correct answer, B. Autoclaving is a standard method for terminal sterilization when compatible with the product. A patient taking Sodalol develops palpitations and dizziness. What is the likely cause? Option A, hypoglycemia. Option B, QT prolongation leading to arrhythmia. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Sodalol prolongs QT interval and can cause torsades de pointes. A solution contains 1,200 milligrams in 60 milliliters. What is the concentration? Option A, 10 milligrams per milliliter. Option B, 15 milligrams per milliliter. Option C, 20 milligrams per milliliter. Correct answer, C. 1,200 milligrams divided by 60 milliliters equals 20 milligrams per milliliter. A patient with psoriasis is prescribed atritretin. What counseling is most important? Option A, safe in pregnancy. Option B, avoid pregnancy for extended period due to teratogenicity. Option C, take with grapefruit juice. Option D, double dose if a dose is missed. Correct answer. B. Acitretin is highly teratogenic and requires strict pregnancy avoidance for an extended time after discontinuation. A patient taking diltiazem is prescribed lovastatin. What is the concern? Option A, reduced lovastatin levels. Option B, increased risk of myopathy. Option C, hypoglycemia. Option D, kidney failure. Correct answer, B. Diltiazem inhibits lovastatin metabolism, increasing risk of muscle toxicity. A pharmacy compounds 400 milliliters of a 2.5% WV solution. How many grams of drug are present? Option A, 5 grams. Option B, 8 grams. Option C, 10 grams. Option D, 12 grams. Correct answer, C. 2.5 grams per 100 milliliters times 400 milliliters equals 10 grams. A patient with asthma is prescribed timolol eye drops. What is the concern? Option A, hypoglycemia. Option B, bronchospasm from beta blockade. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Non-selective beta blockers like timolol can cause bronchospasm, even when used ophthalmically. A patient taking levodopa-carbidopa begins taking metoclopramide. What is expected? Option A, increased levodopa effect. Option B, reduced levodopa effectiveness due to dopamine blockade. Option C, no interaction. Option D, hyperkalemia. Correct answer, B. Metoclopramide blocks dopamine receptors and reduces levodopa effectiveness. A patient needs 2.1 grams of medication. The vial contains 350 milligrams, 5 milliliters. How many milliliters are required? Option A, 20 milliliters. Option B, 25 milliliters. Option C, 30 milliliters. Option D, 35 milliliters. Correct answer, C. 350 milligrams over 5 milliliters equals 70 milligrams per milliliter. 2100 milligrams over 70 milligrams per milliliter equals 30 milliliters. A patient with BPH is prescribed pseudoephedrine. What is the concern? Option A, hypoglycemia. Option B, urinary retention. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Sympathomimetics can worsen urinary retention in BPH. A patient receiving amphotericin B lipid formulation develops electrolyte abnormalities. Which electrolyte is most commonly decreased? Option A, sodium. Option B, potassium. Option C, calcium. Option D, magnesium. Correct answer, B. Amphotericin B commonly causes hypokalemia. A patient is prescribed cabergoline for hyperprolactinemia. What adverse effects should be discussed? Option A, hypoglycemia. Option B, orthostatic hypotension. Option C, kidney stones. Option D, hyperkalemia. Correct answer, B. Dopamine agonists like cabergoline can cause orthostatic hypotension. A solution contains 500 milligrams and 25 milliliters. What is the concentration? Option A, 10 milligrams per milliliter. Option B, 15 milligrams per milliliter. Option C, 20 milligrams per milliliter. Option D, 25 milligrams per milliliter. Correct answer, C. 500 milligrams divided by 25 milliliters, 20 milligrams per milliliter. A patient on chronic opioids is prescribed cyclobenzaprine. What is the concern? Option A, hypoglycemia. Option B, increased CNS depression. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Cyclobenzaprine adds CNS depressant effects when combined with opioids. A patient is prescribed ribavirin. Which counseling is critical? Option A, safe in pregnancy. Option B, strict contraception required due to teratogenicity. Option C, take with grapefruit juice. Option D, double dose if missed. Correct answer, B. Ribavirin is teratogenic. Strict contraception is required for both males and females. A pharmacy compounds 150 milliliters of a 6% WV solution. How many grams of drug are present? Option A, 6g. Option B, 7.5g. Option C, 9g. Correct answer, C. 6 grams over 100 milliliters times 150 milliliters equals 9 grams. A patient with glaucoma is prescribed atropine eye drops. What is the concern? Option A, hypoglycemia. Option B, increased intraocular pressure. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Anticholinergic eye drops can worsen glaucoma by increasing intraocular pressure. A patient on methadone is prescribed azithromycin. What is the concern? Option A, hypoglycemia. Option B, QT prolongation. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Both drugs prolong QT interval, increasing risk of arrhythmias. A patient requires 750 milligrams of medication. The concentration is 125 milligrams per 5 milliliters. How many milliliters are required? Option A, 25 milliliters. Option B, 30 milliliters. Option C, 35 milliliters. Correct answer, B. 125 milligrams over 5 milliliters equals 25 milligrams per milliliter. 750 milligrams divided by 25 milligrams per milliliter equals 30 milliliters. A patient with angle closure glaucoma is prescribed oxybutynin. What is the concern? Option A, hypoglycemia. Option B, worsening glaucoma from anticholinergic effect. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Anticholinergics increase intraocular pressure and worsen angle closure glaucoma. A patient receiving IV foscarnet develops muscle cramps and tetany. What is the likely cause? Option A, hyperkalemia. Option B, hypocalcemia. Option C, hypoglycemia. Option D, liver failure. Correct answer, B. Foscarnet can chelate calcium, causing hypocalcemia and neuromuscular symptoms. A patient with a history of heparin-induced thrombocytopenia, HIT, requires anticoagulation for atrial fibrillation. Which medication is most appropriate? Option A, unfractionated heparin. Option B, enoxaparin. Option C, bivalirudin. Option D, warfarin monotherapy initially. Correct answer, C. Bivalirudin is a direct thrombin inhibitor and appropriate for patients with HIT. Heparin and LMWH are contraindicated. Warfarin alone initially is unsafe in HIT. A patient taking mycophenolate mofetil is prescribed antacids containing magnesium and aluminum. What is the primary concern? Option A, increased mycophenolate levels. Option B, decreased mycophenolate absorption. Option C, no interaction. Correct answer B. Antacids containing polyvalent cations reduce absorption of mycophenolate, decreasing effectiveness. A solution contains 120 milligrams per milliliter. How many milliliters are needed for a 600 milligram dose? Option A, 3 milliliters. Option B, 4 milliliters. Option C, 5 milliliters. Correct answer, C. Volume equals 600 milligrams divided by 120 milligrams milliliter equals 5 milliliters. A breastfeeding patient is prescribed methimazole. What is the best counseling point? Option A, avoid breastfeeding completely. Option B, take methimazole immediately after breastfeeding to minimize infant exposure. Option C, double the dose to shorten therapy. Option D, take only at bedtime. Correct answer, B. Methimazole can be used cautiously during breastfeeding. Taking it after feeding reduces infant exposure. A patient taking oxcarbazepine begins therapy with erythromycin. What is expected? Option A, increased oxcarbazepine levels. Option B, decreased oxcarbazepine levels. Option C, no interaction. Option D, increased serotonin syndrome risk. Correct answer, A. Erythromycin inhibits metabolism and can increase oxcarbazepine levels, increasing toxicity risk. An IV medication must not be refrigerated after reconstitution. What is the reason? Option A, cold temperature increases potency. Option B, refrigeration can cause precipitation or instability. Option C, refrigeration reduces contamination. Option D, refrigeration improves taste. Correct answer, B. Some medications precipitate or become unstable at cold temperatures after reconstitution. A pediatric patient weighs 20 kilograms and is prescribed vancomycin 15 milligrams kilograms dose every 8 hours. What is the dose per administration? Option A, 200 milligrams. Option B, 250 milligrams. Option C, 300 milligrams. Option D, 350 milligrams. Correct answer C. 15 milligrams per kilogram times 20 kilograms equals 300 milligrams per dose. A patient abruptly stops taking baclofen. What is the primary risk? Option A, hypoglycemia. Option B, withdrawal seizures and hallucinations. Option C, kidney failure. Option D, hyperkalemia. Correct answer, B. Abrupt baclofen discontinuation can cause severe withdrawal symptoms, including seizures and hallucinations. A patient using a nitroglycerin patch asks how to apply it. What is the best instruction? Option A. Apply continuously without breaks. Option B. Apply for 12 to 14 hours, then remove to prevent tolerance. Option C. Apply only during chest pain. Option D. Cut patch if dose seems too strong. Correct answer, B. A nitrate-free interval each day prevents tolerance development. A sterile compounded preparation requires removal of pyrogens. Which method is effective? Option A. Filtration through 0.22 micron filter. Option B. Dry heat sterilization. Option C. Refrigeration. Option D. Shaking vigorously. Correct answer, B. Dry heat can destroy pyrogens, whereas standard filtration removes bacteria but not endotoxins. A patient taking disopyramide reports urinary retention. What is the cause? Option A. Hypoglycemia. Option B. Anticholinergic effects. Option C. Kidney stones. Option D. Hyperkalemia. Correct answer, B. Disopyramide has anticholinergic properties that can cause urinary retention. A solution contains 1,500 milligrams in 75 milliliters. What is the concentration? Option A, 10 milligrams per milliliter. Option B, 15 milligrams per milliliter. Option C, 20 milligrams per milliliter. Option D, 25 milligrams per milliliter. Correct answer, C. 1,500 milligrams divided by 75 milliliters equals 20 milligrams per milliliter. A patient on tramadol is prescribed sertraline. What is the concern? Option A, hypoglycemia. Option B, serotonin syndrome. Option C, kidney failure. Correct answer, B. Both tramadol and sertraline have serotonergic activity, increasing risk of serotonin syndrome. A patient is prescribed alendronate. What counseling is most appropriate? Option A, take with food. Option B, take with a full glass of water and remain upright for at least 30 minutes. Option C, take at bedtime. Option D, crush tablet before swallowing. Correct answer, B. Proper administration reduces risk of esophageal irritation and improves absorption. A patient receiving IV pentamidine develops muscle cramps and confusion. What is the likely cause? Option A, hyperkalemia. Option B, hypoglycemia. Option C, hypocalcemia. Option D, hypernatremia. Correct answer, B. Pentamidine can cause significant hypoglycemia, leading to neurologic symptoms. Excellent work. Keep practicing. Keep improving. If you found this helpful, you can access hundreds more free exam-style questions, detailed explanations, and full mock exams at MedPrepPrime.com. Consistent practice is the key to passing the NAPLEX with confidence.